Hey, Lakeisha, can you hear me okay?
Yes, sir, I sure can. How are you doing?
Hey, good. How are you?
Great.
Good. Everyone else, we'll get started in probably about 9 minutes, get people the chance to log on. But I sent your PIN numbers, so you want to make sure that you put that PIN number in so we can communicate whenever we get started. So I'm going to get muted right now, and I'll come back on in a few minutes. For everyone that just joined, if you can hear me, I sent you a pin. You'll want to put that in so we can converse if you have any questions. But we'll always have the chat feature available, and Adrian will be monitoring that. So I'll get started in a few minutes. Good afternoon, everyone. This is Justin at Share. We also have Adrian Jones. We'll go ahead and get started. You want to go ahead and put your PIN number in if you're just joining, so we can converse if you have any questions. But we also have the chat feature, so you can put the chat, put anything in the chat feature, and then Adrian will kind of be monitoring that. So anyway, I'll go ahead and get started because I know you guys are very busy out there in the clinics and hospitals taking care of patients. So I wanted to first, I did an agenda, so I'm going to try to stick by the agenda, and we'll probably end a little early, hopefully, for you all. So I want to first go over our new share ticketing system. Some of you, if you were on the call this last month, I touched base on it, but we're really excited about this. If you have any issues, that sort of thing, you can put a ticket in and then track the progress of that ticket. If you have patient attribution issues, if you have VHR secure messaging issues, if your VPN is down to receive results on your patients in your EMR, all of those are available. So what you do is you go to sharearkansas.com and then go to contact and then go down to technical support. This is how you can submit a ticket on your own depending upon what issue you have. So submit ticket, it takes you to our Share Arkansas Department of Health user support system. You can submit a ticket, and then once you do, you can also view all of your existing tickets. So that's really helpful for any of the, following up on your ticket. You're going to submit a ticket, and then we have multiple choices depending upon what issue you may be experiencing. Like yesterday, we had a little downtime on our Share Secure Messaging, so you may want to put that you have a connection issue. So you would just do connection issue. You would put your name, your email address, your clinic, where you're located, contact email, just a brief description. I'm having secure messaging issues, any other details about what's happening. You can also, if you have a screenshot, you can also attach a document, so our share support can be able to see that, put in the spam prevention number, and then submit a ticket. You can do that for all these different issues that you may be having, or maybe you don't know necessarily which area that you need to contact. You can always put a general in. These routes to our share support or our data teams, and they'll be able to address your concerns. So hopefully you can start using this ticketing system. You know, Adrian are always available for you, but sometimes we're out there in the field, in clinics and hospitals doing training or on the onboarding new facilities, so we may miss some or maybe a delay. This is the fastest way for you to get a response on issues. Also, if you need to activate or deactivate a user, that's one of the selections. So if anyone is out there that's a trusted agent or that project champion for your hospital or clinic or organization, you can submit that user creation form to add new users to the VHR secure messaging. So you would follow that same scenario that I just outlined and then attach those documents. Then you'll be able to track the progress of that. And if you have any follow-up questions, where is my access, that sort of thing, you can always respond back on that ticketing system. You can also deactivate any users. So if you know the users, you know, and you're the trusted agent at your facility, you can list all of the individuals that you need to deactivate, and our share support will deactivate those, and you can follow up with there. So it's just a really easy way for you to be able to submit tickets, and then they can be followed up on. Again, if you have any questions, you can always call our 800 number, 1-855-SHARE-AR. That is available 24/7 for you all, so it's even available on weekends. We have that's Tier 1 support. You can always email ohit.support@hit.arkansas.gov, and then you'll be able to send that request. Does anybody have any questions on that, the ticketing system? So with everything, you know, we're trying to streamline as best as possible, because sometimes things get missed, but you can track it in real time. Again, you can go here, you can put in your tracking number that you got in an email, because once you submit a ticket, that you will get a reply into your registered email that you have, that you put in. If you forgot that tracking, you can put forgot and put your email address, and it will send you all open tickets or all tickets if you submitted. If you've already submitted a ticket once and it's been closed, you can do all tickets and reopen that ticket. So great place for you to be able to go. Again, you go to sharearkansas.com, go to contact technical support, and submit a ticket here. Any questions before I move over to our next agenda item? Okay, so I wanted to talk about our registries. I know for individuals that are going after hospital systems that are going after meaningful use stage 3, or if you're a specialty clinic or Medicaid clinic, you're still going after stage 3, but you may be going after MIPS or part of a MACRA. So this is on our website here. You can go back to it, but I wanted to talk through the process. A lot of hospitals, the 2 requirements for meaningful use stage 3 that we can assist with is creating that CCD interface to where your hospital system is able to query for any results of your patients and get it back. So we call that bidirectional interface with Share. Clinics can do the same way if your vendor allows it. Most hospital systems and most clinics can now do bidirectional CCDs or continuity of care documents. So if you're not in the queue with us if you're already a live hospital or you're already a live clinic with your EMR, and maybe your EMR, you're just receiving results, or your hospital system is just sending data, well, the whole goal is for you to get it back. So if Justin Valines or Adrian Jones comes into the emergency room at North Arkansas Regional Medical Center, or JRMC, we essentially, we do have the virtual health record as our web-based portal, but you want your system, you're already in your Meditech system or Allscripts or Epic system. You want to be able to query for any results on that patient and get it back, get a response. That's what that bidirectional CCD interface is. And that assists you in meeting the requirements for meaningful use stage 3, also with MIPS. So we use XDS.B protocol or XCA. Those are the standard protocols for all EMR systems to make that connection. So we are really working with a ton of hospitals and clinics to meet that initiative for meaningful use stage 3, or if they're going after MIPS. So, if you have any questions on that, you can always email me or Adrian, and we'll be able to assist you with taking the next steps. Or if you're a hospital that's already connected and you want to move to that direction to meet some of those requirements for MU, we can work on making sure we have all the paperwork in line, but then also get you in the queue to start that process so you can meet those initiatives by the end of the year. Is there any questions on that CCD or that query and response or meaningful use stage 3 MIPS MACRA? For the MIPS and MACRA, we have it on our website as well, and these are some of the categories, that you are responsible for. So part of that, if you are under MIPS, one of your promoting interoperability and doing that bi-directional is 25% of your score. You have to report on a 90-day window, and we can be able to assist you with that. Also, you can use Share to, essentially be able to track those ED visits more frequently, so you get that information right in your EMR system. You can increase quality because you are starting to follow up and get the results of your patients, so you are able to bring in those results to find if there's a mammogram, you can find if there's immunizations done, et cetera. So you're increasing that quality, and through that process, we can assist in each of those. So these are kind of what we laid out of how we can increase your improvement scores or your ACI scores, and depending upon what size of clinic you are. So you can go to providers, MIPS, MACRA, or Health Information Exchange, and then be able to find out about the CCDs. We have the CCDs here. What is a CCD? How is it, useful for your hospital, et cetera. So if you have any questions that are more in depth, please let us know, and we can set up a call with you or your IT director so we can be able to address those. Any questions before I move to the next topic? I wanted just to keep you guys abreast of everything that's going on, so that if you kind of miss the mark on certain things and not sure how Share can be able to assist you, that we continuously talk about it so that you can really talk to your C-suite, so that we can assist you at Share to meet those initiatives. Adrian, is there any chat? Okay. You can always use the chat function as well. Part of the CCD as well is that we are working on a national connection of the eHealth Exchange. So if you've heard me talk about it in the past, but we are live there and are doing testing, and our whole goal is to go live with the VA this year. So if you are integrated and you're querying Share for CCD, you will also be able to query the VA system, including the clinics, to be able to get the results of your veterans out there. We know we have a lot of veterans within our state. We have 3 VA hospitals and around 20 clinics that are around the state, and patients go to civilian doctors, but also go to the VA doctors. So those results are out there, made available, and we will be making that connection. You will have to be able to have that integration to be able to query that VA data. So I encourage you, if your clinic is not integrated with your EMDs or your Greenway or your office practicum, ECW, please reach out to us and we can start the ball rolling and we can guide you in the direction on what questions to put a ticket in with your vendor, with Athena, get your IRIS number, or with Greenway reaching out to make that integration happen. Because essentially our whole goal is to get everybody connected in the state. Sharing data, not just accessing the web-based portal. The web-based portal, which you guys have access to, is the virtual health record, which is great, but you're only accessing the data that's made available from those other contributing. So if we really want to work on that true interoperability and understand where all of our patients are going, the integration is key with where we integrate with your EMR. Mm-hmm. Okay, Abby, we got your question on the mapping on ECW. So if you want to just shoot me an email, and then we can be able to set up a call to be able to talk about the specifics on there. We'll get you answered. Diane also said, does the CC go into the EMR as a report or integrate into the system? We like and we push to have that integrated. So if you are querying for the results, that it actually goes into view and then consolidates with the labs, with the medications, etc. We work with your vendor on that to make sure that that happens. Some vendors only bring it in as a CCD document for viewable and made part of the chart, but then also that has a CCDA, which is parsable, and it parses out into the categories with your EMR system. Diane and Abby, does that answer your question? Okay, so if you aren't currently at your hospital system or clinic and query and share for that, you want to reach out to us and get in the queue. I think, you know, right now we're working with, I think, 65 different organizations, including our other HIE connections. If anybody hasn't seen that in the past, we are part of SHEIC, which is the Strategic Health Information Exchange Collaborative. And essentially what we do as a phase 1 is that we're connecting with HIEs across the nation. So that admission discharge transfer, if an Arkansan goes to Colorado skiing, that information comes back to share. We're already in the talking phases of about expanding that to where we'll bring CCDs. Right now we're working with Missouri Health Connection. So essentially, hopefully this will be done this year or the next, quarter or two. But if an Arkansan goes up to Missouri, and we have a lot of Northwest, all of northern parts, so Jewish Barnes, Cox Health, Mercy, that complete record will come back to share. And then if you are connected and you're querying, you'll be able to query that information. So we're looking at expanding that beyond not just Missouri, but then expanding it outside of the SHEIC initiative. Our director, Ann Santifer, is actually at a national conference of SHEIC this week, getting all the latest and greatest and kind of the next steps and next phases. So we're really excited about this because we know our patients are very mobile. So that's going to allow us to be able to see a clearer picture of our Arkansan patients. Any questions on that? Okay, remember we have the chat function if you just joined. Okay, so I want to move on to the immunizations. We support bidirectional immunizations, so there is no reason for you to be able to do start doing duplicate entry for put it in your EMR system and then sending it, and then also logging into WebIZ and then putting the immunizations there. So we do report to the immunization registry, WebIZ. So now we support bidirectional, meaning that you're able to then, once you're live sending immunizations through Share, you work with our ADH counterparts and you'll be able to query WebIZ and get a response. So if you had your immunizations done at ExpressRx, or if you had it done at the Kroger or Walgreens, they report all that to WebIZ as well. So you as clinicians or hospitals, you'll be able to query and get that response for immunizations. That is a requirement also for Meaningful Use Stage 3, and we're able to assist hospitals and clinics to be able to meet that measure. So if you are currently doing duplicate entry, or you have an interface, but your vendor currently doesn't support that bidirectional functionality, we do support that here at Share. We already have a live connection with the immunization registry. So if you want to send your immunizations through us, we set up that interface, and then we can start testing with them with our ADH counterparts. You have to have, I believe, a 95% error-free, and then you go live. So you put it in once, and then we'll send it on your behalf to ADH, but then also you can be able to query that. Okay, we have a question from Jennifer. She said, how does it show up in WebIZ after it's ended in Share? Well, it comes in as we grab all your immunizations and we report it just as you manually enter that into WebIZ. So we grab it, all your immunizations, and that's why there has to be a 95% error-free, because they check all the message types that are coming from your facility. If you're reporting all your flu vaccines, or any other vaccinations that you have, especially on your kiddos, we can send that on to you. So those are, we grab them, I believe, just every day, all your immunizations, and then send it on. So it's real time, information that's flowing over to ADH WebIZ. Does that answer your question, Jennifer?
So it isn't like within 10 minutes, it's the next day?
It depends. I believe that it is, and I'll have Adrian see if we can check with one of my tech leads. I'll by the end of the call, I'll have an answer to that, if it's the real time after it's signed off on, or it's at the end of the day. And it may be dependent upon your EMR, but I will get an answer on that for you, okay?
Okay, thank you.
You're welcome. All right, she's going to call our tech lead and see what that, get that answer for you. Okay. We are excited that, we are also live with our syndromic surveillance electronic lab reporting, but we also are live with our eligible professionals, our provider clinics, on the cancer registry. We hopefully will be live this year. Our ADH will be able to accept for hospitals to report your cancer disease to the disease registry, but we are live with the cancer registry. So if you are an oncology clinic, or you are a clinic that needs a report for your cancer registry, we support that. So please reach out to us, and if you want to make that connection, we can. Our ADH counterparts have said that we're supposed to go live on the hospital side this year. So especially like UMS that has a cancer institute, or some of our other hospitals that do cancer treatments, you'll be able to support that, or you'll be able to send that through share, and then we'll be able to report that to ADH, the cancer registry. Diane, yes, clinics we can support with your clinics now with the provider clinics on the cancer registry. So we can grab that information. Again, it has to have an error-free rate, and we can help guide you through the next steps on that cancer registry on your clinics. So if you want to make that connection, we'll have to integrate with your system and then start that testing with the cancer registry on sending all of your cancer information to the registry at present. And then that would do away with your manual enter if you're doing that manually entering right now. Diane, does that answer your question? Okay. Just let me know for anyone out there that wants to start reporting on that. We support that. We're looking at expanding that out, as I've mentioned in previous, is another couple other registries. You know, since we're part of ADH, there's all these registries from stroke, trauma, to the prescription drug monitoring program, and we're looking at integrating the HIE in all of those eventually. Do I have a timeline on that right now? No. There's a lot of hurdles that we're working through with making those different connections, but we will keep you abreast of all of those different registries that we go live on. So with the cancer, I wanted to update you on there, especially for those eligible professionals. Okay. Okay, so I wanted to touch base again. I was at the CPC Plus conference this last week, and we all know that we're a CPC Plus state, which it's a Medicare initiative. So we are excited about our daily reports that go out, and this actually is a daily report that went out for a clinic that does all patients notifications. So if you are a clinically integrated network, or you are behavioral health, or because we're actually doing these for a couple of behavioral health clinics too, for their high-risk patients for behavioral health needs. If they're getting treatment in an outpatient facility, we actually can get that attribution from the behavioral health clinics and send a daily report on all of those behavioral health patients that are going to the ER, so those psychiatrists can follow up with them. We're also doing this for clinically integrated networks, where we can, if we got a list of all your patients with specific data sets, we can start notifying you. Just like we have for many years now, notified care coordinators and providers that are in the PCMH program and are Medicaid. We stopped those individual notifications altogether, and now we only send the daily reports out. But this is an actual daily report that went out. Of course, PHI has been blocked out, but you can see all of the different hospitals that those patients are visiting. So it's quite a few. So a lot of people say, well, I know my patients probably go to just my Baptist clinics or hospitals, or they only go to, South Mississippi Medical Center, because that's where I know that's where our patients go. Honestly, when clinics go live with all patients, you will be, and I do, analysis, and our data team does some analysis. You can see here that these are multiple hospitals that patients are going to. We're very mobile individuals in 2019 and moving forward. Doesn't matter what payer you're with, patients are going to go to the emergency room when they need it, and then go from an inpatient stay. And sometimes that's out of your system. It's in the statistics that's out there, and it continues to support it, that healthier patients in their lifetime, they see around 18 different providers. And those providers are not always in the same health system. So the great thing about it is that we can have that date and time stamp. So if you're part of Blue Cross Blue Shield, the CPC Plus clinic, a Blue Cross Blue Shield PCMH Qual Choice or Centene now, PCMH, we can be able to assist you in tracking all of those beneficiaries. A lot of you are dinged, or you have a potential to get shared savings at the end. So if we are capturing all patients and you're treating them the same, then you'll be able to see those high utilizers of the ER. You're able to see those patients that are going to the ED when your clinics are open, and knowing that you have open access for your clinic. So it really informs you and your care management team, your providers. It prevents those hospital readmissions, which the hospitals love, because, you know, the hospital side, they're penalized up to a 4% penalty on all readmissions. And then this year, Arkansas Medicaid, for instance, has one of their deliverables is tracking those ED visits and those inpatient visits. So if you out there and you're a clinic and you're referring to a hospital out there and they're not connected to Share, I encourage all of you, have your doctors reach out to the CEO, the IT director, and say, why aren't you connected to Share, the statewide HIE? They're growing, they're continuing to expand now that they're under ADH. It's new, improved, and continue to be a plethora of knowledge of what's going on with our patients. We need to know this, because at the end of the day, you as clinics or even hospital systems, you are really looking at containing that cost. And so these are, if you need some talking points on what to email that CEO of that hospital system or that IT director at that hospital system, right here, what I have highlighted is some of the information that we can assist with. And it also assists you in turn. So we're really working all together to really improve the health outcomes of our patients here in Arkansas. Any questions on that daily report or the next steps to take? Remember, we have our chat function available as well. If you're part of a clinically integrated network and you want this for all patients, if you want this at your clinic level, we can just shoot me an email and we can make it happen. There's specific information that we need, but we can then go ahead and start getting you live on all patients. I know all of our clinics that are currently getting this are extremely happy with getting those notifications on all patients. You may say, well, my local hospital sends this. Well, that's good, but remember, your patients may go outside of your local hospital, of all the hospitals that we have connected. So we can be able to notify you and start getting that, so you can start curtailing the habits of your patients going to the ED when your clinics are open, or start reducing that so you can get them back in the clinic to be seen. All right. I'm going to kind of give you an update on our progress. You can always go to our website and go to Who Shares and see the data available and share from our hospitals. We are working to update this for all of our clinics as well. But right now, you can actually download this as a Excel to be able to see who is connected to Share currently. But we're also going to be providing this on our website of what data is made available, say from like Arkansas Urology or MANA clinics or specialty clinics or an SQHC that's connected in your area. So we're working on that, on getting that all in a readable format to where you can be able to go there and see, because as we continue to expand, I know that's a first question that you say, well, who's sending data, what's available, et cetera. So we want to be transparent, but we also want to make sure that the data is correct. So that's what we're going through with this fine tone, looking at all of our connections so that we can then provide that just like we are with the hospitals. Some recent hospitals that I sent agreements to that are looking at fully integrating. I had a call with Mr. Decker at Forest City. and I sent agreements to him. They have agreed to connect to Share, and that includes their clinics as well. So we're going through the process right now. So we're really excited about bringing on Forest City Hospital and clinics. So that would really help over there in the western part of the state. We also have sent an agreement to the Medical Center of South Arkansas. We have a signed agreement to integrate with all of their clinics, but we are looking at integrating with their hospital as well. Right now, we're working with Washington Regional and their clinics to integrate up in the Northwest region. So we're excited about that because there's a lot of clinics up there that maybe if you're over in the Northwest region of the state, your patients may go to some of those specialty clinics. So we're looking to expand in that region as well. We have reached out and we have agreements in hand. So if you are down in the Southwest region of the state and you refer to Chris's St. Michael's, we did have a call with them and I sent agreements for us to integrate with their system. I have been doing follow-ups with them and they said they are, talking it over within the system. So we're really excited, especially for our Texarkana, Arkansas, or up in that region, that your patients a lot of times go over to the Texas side. We're very aware of that. And we were lucky. We finally got a call with them and I sent agreements for them. We have not got a yes on that, but I am still pursuing. So I encourage you, if you are in that region, down in Miller County, Lafayette, Hempstead, Little River, Howard, Ouachita, patients go up over there. So reach out to them, say, hey, what's the status? That sort of thing. Over in West Memphis area, we had a call with Methodist, Le Bonheur Methodist Health System. That includes 6 hospitals, 1 in Mississippi, and then a lot of clinics. We sent agreements to them as well. I have followed up with them, and so hopefully they will come on board. There is no health information exchange in the Memphis area. There's only one HIE over in East Tennessee, but there is no HIE there in the West Memphis area. So if you are an FQHC or you're a clinic over in Crittenden County, Cross, St. Christmas, Mississippi, Lee, reach out to them. Say, hey, I heard that you had a great conversation with Share. Where are we? Because I think it takes both of us, not just us beating on the door, but you as their referral partners to be able to do that as well. And then hopefully our other, hospitals will come on board, such as St. Bernard. I know we're getting ADTs from them and their Lawrence County and the hospital in Wynn. But I know that a lot of our referral partners are requesting, laboratory results, radiology reports, transcribed documents. So we're hopeful that they will become fully integrated. And then hopefully our NEA Baptist hospital. We are live with all of their clinics, but not their hospital. And especially their new critical access hospital in Crittenden County, we would love to be integrated with them. Our prices have been reduced to be able to connect, as well as you can let all of them know that at Share as a state agency, or that under ADH, that we waive all implementation fees. We were fortunate enough to get federal funds to be able to offset the cost of implementation fees for all hospitals to become fully integrated. And that is made available, within this year and maybe next year. But after that, we will have to charge implementation fees. We have reached also and had a great conversation in a meeting with Baptist Health. They have bought the Sparks Health System over in Van Buren and Fort Smith area. So we do get ADTs from all of Baptist, but we do not get laboratory results, radiology reports, or transcribed documents. We have sent an agreement to them, and they are discussing it. But if you are not getting those, and I encourage you to reach out to their team and see if they would integrate. So those are just a few that we I wanted to keep you abreast of an update in our progress throughout each corner of the state and where we are, because I know that I get those questions a lot. But I'm going to stop there and see if there is any questions, because I want to be respectful of your time. You can always blurt it out here, or you can use the chat function. Anyone have any questions of me? Give it a few minutes. Hopefully, I've answered a lot of your questions today. If I've missed a couple of things, you can always shoot me an email and ask me very specific questions on the who, what, when, where, and how, those type of questions. So I'll be able to kind of go more in detail with you, or if you have specific needs at your healthcare facility. Any questions? Yeah. All right. Well, I'll leave you with this. I know that a couple of EMR vendors that we are working with a lot is Athena. We have an Arkansas hub. We're doing CCDs with ECW. We had a call with Greenway. So I know if you're on Success EHS, that'll be moonlighted and you'll be moved over to Greenway Entergy. But we can do CCDs with Greenway Prime Suite and Entergy. So if those are your EMR vendors, we can integrate with you on that and do CCDs. We can do the traditional HL7 type messages. If you're a pediatric practice with Office Practicum, we can make that integration on that. Doing our traditional HL7, they support that. If you're a hospital out there and you need direct secure messaging where it's integrated within your EMR, we provide that as an option for you. So if you're trying to expand that P2P, or you are a critical access hospital and you need secure messaging, we can provide that street for you to be able to communicate and share CCDs with an XDR connection. So I want to leave you with that, and hope everyone has a great day. And again, I try to have these the fourth Wednesday of every month, and I will send out an email to everyone. And if you have other staff that need to hear this or get an update, please forward it on to them, so that we are being transparent, but we're also educating you on where we are at Share. So I hope everyone has a great day, and enjoy the spring weather out there. Bye-bye now.